Graham Morris.
Here, here.
Hi. Well done. Thank you very much, Ms McVeigh, for calling me to speak in this important debate. And I would also like to thank my friend, the Honourable Member for Westmoreland and Lonsdale, for securing this debate. I'm sure for the Minister this must seem like Groundhog Day with a whole phalanx of MPs who are supporting the cause for more resources for cancer. But this is a very serious issue, and I make no apology for rehearsing these arguments. And until we can see tangible results arising from our lobbying efforts, I'm afraid that's going to continue. I thought the Honourable Member for Westmoreland and Lonsdale made an excellent opening speech setting out the arguments in a thoroughly cogent and thoughtful manner. And I also want to pay tribute to the NHS workforce, but in particular to our cancer workforce. Not just the oncologists, but the therapeutic radiotherapists, the technical staff who keep the service running, and those key personnel who work behind the scenes, often unacknowledged, whose expertise have the potential to improve cancer outcomes. I thought the speeches have been excellent so far, but if I could just take issue with one point raised by the Honourable Member for Warrington South, because we have a little bit of time, and that's in relation to our cancer performance. Our focus in this debate is in what we can do immediately to address the cancer backlog. But I would respectfully point out that even before the pandemic, our performance in relation to cancer outcomes wasn't world-beating. In fact, in the 7 most common cancers, when we make a direct comparison with similar advanced countries in terms of industrialised countries, we were either bottom or second bottom. So there was a job of work to be done even before the pandemic, and the impact of COVID has kind of shone a spotlight on that. The charity Action Radiotherapy, and I have the great privilege to be Vice Chair of the All-Party Group for Radiotherapy and Vice Chair of the All-Party Group on Cancer too, estimates the full cancer backlog stands at over 100,000 patients, and agree that it would take cancer services working at over 120% of pre-COVID capacity for 2 years just to catch up. And I think the chair of the Health Select Committee actually agrees with that figure, having done some research of his own. I really do think we need to have a distinct plan. It can't be simply a case of members lobbying ministers and asking for more resources. We need to quantify the scale of the problem. We need an action plan, and I'm very much aware that we have a cancer recovery plan, but we need an action plan that addresses all of the issues. And I also believe, Ms McVeigh, we need somebody to lead it, somebody with some clout. And just last week, the government announced that the Honourable Member for Stratford-on-Avon was going to be the Minister responsible for driving forward the vaccination programme. And I think this is such an important area of concern to the public and to the broader community that we really need to have someone with some clout, preferably a minister or some senior person within the NHS, to be given the responsibility for working to drive this initiative forward. Experts are predicting between 35,000 deaths and 60,000 lost years of life, with cancer survival rates having been pushed back to where they were 10 to 15 years ago. I do think we need to address this issue, because when we've, in questions and in previous debates, ministers have responded. I mean, no disrespect to the minister who's in a place at the moment, because I know that she fully understands the issue, but I don't want to make any apology here. That there is a difference between investing in diagnostics and investing in curative treatments. There is a difference between radiology and radiotherapy. And I'm not convinced the Secretary of State understands those differences. We welcome the additional investment in digital imaging and improved diagnostics, but we must address the issue of how we get more resources, how we improve the number and quality of the skilled cancer workforce to really get to grips with the backlog. I think it's appropriate to mention the implications of the pandemic for prostate cancer, also referred to by the Honourable Member for Warrington South. This is Movember, after all, when men grow moustache to raise awareness and funds for men's health in the month of November, and that ended earlier this week. Indeed, Prostate Cancer UK have identified two major concerns. Firstly, the detrimental impact of GP referrals for prostate cancer referrals. And it did come to my mind, Ms McVeigh, when my honourable friend, the member for Gower, mentioned the three referral pathways of A&E, of GP referral, and what was the third? And the screening programmes. There is a massive issue, and I suspect members in this room have some experience of how difficult it is, particularly for older people, to actually see their GPs at this time. If you do have particular concerns about the possibility of having early symptoms of cancer, it's extraordinarily difficult to get a face-to-face appointment with a GP. And I think that's, again, it's an issue that really needs to be addressed, and it's having an impact on the backlog. The second point I want to make in relation to access and support and communication for men, both at the time of diagnosis for men living with side effects and advanced disease. NHS England and Prostate Cancer UK calculations suggest there are currently between 3,000 and 5,000 men with undiagnosed higher risk prostate cancer who would otherwise have been diagnosed had referral rates been at pre-COVID levels. But in the time that I've got, Ms McVeigh, I want to focus on two main areas, and I've got some specific asks of the Minister. And the first of these, which I've raised on a previous occasion or previous occasions, is in relation to data information. And we've had statements made by the Department for Health and Social Care from ministers and senior NHS leaders indicating that they don't have any accurate estimate of the full cancer backlog of delayed treatments, diagnostics and screenings. Well, the publication of the radiotherapy data set, and it is available, would show precisely the extent and character of the backlog, because it would make a comparison with the position now compared with the position 12 months ago. For reasons that are not apparent to me, the publication is being delayed by NHS England. So my first ask of the Minister is, why are they being delayed? And why won't these data sets, the radiotherapy data sets, be published? I don't know whether NHS England are being too slow to act, whether it's some kind of bureaucratic hold-up, but it's something that must be driven forward, and it's imperative to ensuring that the cancer recovery plan is accurate. So, this is despite the fact that that NHS England and ministers are fully aware of the effects of the pandemic on cancer services, and we've been raising this from as long ago as April. It's clear knowledge is power, and a lack of accessible data is resulting in an inability to catch up with cancer. And let's be frank about it, people are dying unnecessarily as a result. There was that awful case of Kelly Smith, one of many tens of thousands, a 31-year-old mother of three who died as a result of delayed treatment for bowel cancer. Absolutely tragic. And it caused her family to launch the campaign and the petition Catch Up with Cancer, which now I believe has almost 400,000 signatures. So, I mean, if that doesn't concentrate the minds of ministers, I don't know what will. A lack of accessible data is resulting in an inability to catch up with cancer. and unnecessary deaths. The second point I want to raise, Ms McVeigh, is in relation to the comprehensive spending review. And in particular, the lack of any detail and specific reference to funding for modernisation of radiotherapy services. The announcement by the Chancellor last week was most welcome, but in response to a question from the Honourable Member for Westminster and Lonsdale, when asked about the cancer backlog and additional resources specifically for advanced radiotherapy, he was referred to health ministers and the Secretary of State. So I really think we should be aware radiotherapy is safer to administer during the pandemic than alternative treatments. There's no attempt to set up a competition here, but we have to recognise that radiotherapy is non-invasive and it's COVID safe, and it has a range of applications. It's needed by about half of all cancer patients and is a significant treatment in 40% of cancer cures. I'm someone who's benefited it myself on 3 occasions. It's also hugely cost-effective, curing patients for as little as £5,000 to £7,000 per treatment. It's very efficacious in terms of the curative rate. It could do so much more to clear the backlog and is being held up by underfunding and bureaucracy that's slowed the rollout of new technology now for a number of years. Despite freedom of information requests showing that nearly half of the trusts are using radiotherapy machines that are 10 years over or older, it appears that the spending review only includes funding for diagnostic machine replacements and not radiotherapy treatments. Even before the pandemic, Radiotherapy for Life was estimating there were 24,000 patients that didn't have access to radiotherapy and would benefit from it. So will the Minister commit to improving access to local radiotherapy by investing in new networked treatment delivery centres? Furthermore, will the Minister consider all the elements of radiotherapy's 6-point plan to transform radiotherapy services to ensure we have the treatment capacity to catch up and that the bureaucracies which have created or contributed to creating the backlog are swept away? No doubt about it, we need, to use the Prime Minister's words, a supercharged, super boost treatment capacity if we are to address this cancer crisis. Thank you.